Okay, we're ready to begin. This is my son, and we're making a new video, and hopefully do this on the iPad, and maybe upload directly from the iPad, and have better luck. This is Alex. Okay, you ready, buddy? I know, it feels silly. Come on, you gotta sit up for me. All right, so today Alex has come to the nurse practitioner for his annual physical. And the first thing that we're gonna do for you is we're gonna inspect his eyes. You need to come forward to me and move over a little bit. We're gonna make sure you stay in the video because my teacher needs to see me the whole time, okay? So I would look at the corneal light reflex using, getting in there. And gonna assess the muscles of the eyes for cardinal movement. So you follow my finger. There. Through. Very good. 6 fields of vision. Excellent work. So we look at the lids and the lashes, and we're looking at the conjunctiva as well, looking for the sclera of the eye for the color. Checking your pupils for light reactivity. I would, if I had a pen light in my hand, go in like that. Coming up this side. Okay. We're making sure that the pupils are pearler, round, reactive to light, and that they accommodate. Yeah, okay. So, we also use the ophthalmoscope to observe the red reflex and observe his optic disc. Come here for a moment. I don't have a light in here, but I would get in real close, looking at the optic disc. Okay, so moving on from your eye, you're a good patient. We're gonna look at your ears. Okay, so come forward a little bit. Mommy, make sure she's still on the camera. So we would look at the pinnae of the ears. We're looking at the shape, the size, the position of the two ears, looking for symmetry, palpating the ears, looking for tenderness or irregularities. The ears don't hurt, do they? No? Okay. So I would then use my otoscope, give me that back, and I would come inside the ears, and I am looking for the tympanic membrane, and the ear canal, both sides of course, looking for redness and swelling or fluid, those sorts of things, getting right up here, up close, checking the ears. Okay, and a hearing test could be performed at this time as well, if we were doing that sort of an assessment. If you were complaining of some kind of ear fullness or hearing loss, you have a question right now? What's your question?
Is it possible to edit this video in any way?
No, sir. Sit up for me. Okay, so the next thing is your nose, okay? So we would feel the nose, palpate the nose. We are looking for edema, irregularity, looking at the skin of the nose, looking for lesions, looking at the color, palpating the bridge, all the soft tissue of the nose, as well as the sinuses. Does anything hurt? Nothing hurts when I palpate your sinuses. Okay. Sorry about this one. You're not gonna like this. So using the otoscope, I would come. You gotta let me. Okay, Alex, it's for my school, please. Thank you. He's not gonna let me, but we would come up inside the nose. We'd inspect the turbinates and the septum. We're looking for color. We're looking for swelling, making sure that there's no discharge, making sure that the septum is patent. Okay, so that wasn't so bad. You need to let me pretend. Okay. So then we move on to his mouth and throat. You still need to come forward. All right. So we're looking at his lips for edema, lesions, color. Nothing there. They look perfect. Let me see your teeth and his gums. No bleeding. No gum disease. Good hygiene. You note the color of the patient's breath. Excuse me. The odor of the patient's breath as well. And then you ask your patient to stick out your tongue. Yeah, like this. Can you move it side to side? All right, testing the cranial nerves by having them move their tongue from side to side. And we shine a light in the back of your throat. Open up, stick out your tongue, say ah. We're going to check at the tonsils, looking for exudate, making sure that there's no redness in there, those sorts of things. And if I had a tongue blade, I would assess for the gag reflex, turn the tongue from side to side with gloved hands. Okay, so then I need to get to your neck, honey. Palpating his neck for lymph nodes and feeling the carotid pulses as well. Of course, these have to be done one at a time. I'm On this side, feeling the pulse, on that side, feeling the pulse. Checking the lymph nodes, including the back of the neck. Okay, and then last we would auscultate the carotid artery looking for bruits. So go listen to your neck. And you take a deep breath.
You said lastly.
Not yet last.
Like you said
Last of your
lastly.
head and neck. Okay, so no bruits there. All right, so, oh, and checking the thyroid as well. Honey, stop. You're gonna get me bad credit if you don't cooperate, so. Cardiac. Inspect the chest wall for symmetry. Sit up nice, straight, and tall for me. That's fantastic. So we locate the apical pulse, and that would be the point of maximal impact. And it's located at the left fifth intercostal, and we would be palpating for rhythm as well there. Looking for JVD here, and of course, being 12 years old, he doesn't have JVD. Palpating the carotid pulse I've already done, and as I said, independently. We would also, as part of the cardiac assessment, check the capillary refill, pressing the fingernail beds down. We want to make sure that that capillary refill is less than 3 seconds. Okay? We look for edema in the extremities. Certainly no edema, no pitting edema. Everything is good with that. We check all of his pulses: radial pulse, ulnar pulse, axial pulse, and the pedal pulses, particularly often neglected, but should be checked as well. So we auscultate the heart sounds. Raise your right hand. Okay, just fine with you. And we have to listen to
Take off your hat.
5 areas of the heart. Sit up nice and straight for me so I can get in the right place. Good job. Okay. Excellent. Okay. So I'm making sure to note the rate, note the rhythm, and I'm listening for extracardiac sounds, of course. So moving on to respirations. And this can begin kind of when you enter the room. You can watch for the symmetry and expansion of the chest. Normal respiration is 16 to 20 breaths a minute. And I know that a good time to count the respirations is when you're taking the pulse. Take an extra minute, count those respirations, inspect their chest at that time. Sit up for me. No, right there. Okay, so palpating the rib cage. Hold your arms up like this. For masses, tenderness, depressions, unusual movement, you want to really get hands on there. And I should turn so they can see your back a little bit. Turn sideways for me. Super. You're doing great. It's almost over, but so holding a flat palm on his scapula, I would be feeling for tactile fremitus with my flat palms, and I would move my hands down the sides. He'd be sitting up nice and straight for me, and I'd be comparing the left to the right. Okay? Assessing the chest wall, I'd be looking for. Okay, so we then auscultate the breath sounds. Okay? So we would like to look for the pitch, the intensity, the quality, the duration of inspiration, the duration of expiration, those 2 phases, and listening for adventitious sounds. So that's typically when your NP says to you, take a deep breath for me. And again. I would move slowly down the back, being sure to come in here under the rib cage as well. Take a breath. Excellent. So, no adventitious sounds. Lungs are completely clear to auscultation. Fantastic. Make sure I didn't miss any. Sit up, please. You gotta behave. Okay.
If I'm behaving, there would be a doctor's.
So also percussing the chest wall, something that I forgot, but we would be looking for resonance by tapping on the back, making sure there's no hyperresonance, no particular dullness, all of those palpitations. Okay, can you lay down? Just like you're at the doctor's office, you're gonna lay flat on your back for me, okay? So when you're inspecting the abdomen, can you be a little flatter for me, bud? Looking for distension, looking for symmetry. I would assess his skin, looking for lesions, rashes, spider angiomas, anything that's abnormal there. And I would auscultate all 4 quadrants for vowel sounds. It can take up to 5 minutes per quadrant, but I've never had an experience where I had to do that. And we would be listening here, 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 and here. Okay, so you have to percuss for dullness, you know, the liver, percuss the spleen. And after that, you do palpation. You go in all 4 quadrants light, right? And then a little deeper or moderate, all 4 again. And then deep palpation of all 4 quadrants. Looking here for rebound tenderness. I can test Murphy's sign for inspiratory arrest. Take a deep breath. Want to hear it? Oh, good. Excellent. Okay. Palpate for aortic aneurysm. And of course you have to palpate, put your hands here, palpate the liver, looking under the edge of the rib cage for the liver border. And we do not have an enlarged liver, thankfully. And you're going to palpate on the other side for the spleen, which we know should be non-palpable. And to palpate for the kidneys, you have to come in with the opposite hand. And then if I were able to, I'd go to the other side and come in with the opposite hand and palpate the kidneys. Sit up. Sit up for me. So I tried to do this quickly because my volunteer
Is
is
this it?
a little less than willing.
Is this
I hope
it?
that I can get this uploaded, buddy. I need you to use your best manners,
Is this all?
okay? He's gonna go back to his video games. If you have any difficulty or if you need additional explanations or you need me to go a little slower, I'm really happy to comply. I'll have to get a different family member to volunteer. The first video was my daughter. It was a little different. It was longer, it was bigger, couldn't get to upload. Hopefully I touched on all the main points for you here so you can see. And if you'll use this along with my SOAP note, which shows all of the pertinent negatives that I would truly be looking for had this been a full-grown adult and a more cooperative. Please let me know if there's something more I can do. Thank you so much.